Vitamin D is an essential fat-soluble vitamin that plays a crucial role in maintaining bone health, supporting the immune system, and regulating various bodily functions. It is often called the sunshine vitamin because the body produces it when exposed to sunlight. However, many people worldwide suffer from vitamin D deficiency due to limited sun exposure, poor dietary intake, or certain medical conditions. This article provides a detailed exploration of the symptoms associated with vitamin D deficiency, their impact on overall health, and potential risk factors. One of the earliest and most common symptoms of vitamin D deficiency is persistent fatigue. People with low vitamin D levels often feel tired, sluggish, and lacking in energy, even after getting adequate sleep. Studies suggest that vitamin D plays a role in mitochondrial function, which is essential for energy production in the body. Chronic fatigue can significantly affect daily activities, productivity, and overall quality of life. Vitamin D is crucial for calcium absorption in the body. Without sufficient vitamin D, bones become weak and prone to pain. Many individuals with vitamin D deficiency experience deep, aching pain in the bones, particularly in the lower back, legs, and ribs. There's also an increased risk of fractures due to decreased bone mineral density. Muscle weakness is another common issue, making daily tasks such as climbing stairs or carrying objects more difficult. Severe deficiency can lead to osteomalacia, or soft bones, in adults and rickets in children, both of which are characterized by skeletal deformities and pain. Vitamin D plays a vital role in boosting the immune system. It helps the body fight infections by promoting the production of antimicrobial proteins. People with low vitamin D levels often experience increased susceptibility to colds, flu, and respiratory infections. There's also a higher risk of chronic illnesses such as pneumonia or bronchitis. Recovery from infections and wounds tends to be slower. Studies have linked vitamin D deficiency to a higher risk of autoimmune diseases, including multiple sclerosis, rheumatoid arthritis, and inflammatory bowel disease. Mental health is closely linked to vitamin D levels. Several studies suggest that low vitamin D levels contribute to an increased risk of depression, anxiety, and mood disorders. Seasonal affective disorder, or SAD, is a type of depression that occurs in winter due to reduced sunlight exposure. Low vitamin D levels can also lead to cognitive decline, memory problems, and brain fog. Vitamin D helps regulate serotonin, a neurotransmitter responsible for mood regulation. Therefore, maintaining adequate vitamin D levels can improve mental well-being. Hair loss is another possible symptom of vitamin D deficiency. While mild hair shedding is normal, excessive hair loss may indicate an underlying health issue. Vitamin D is essential for the growth cycle of hair follicles, and its deficiency has been linked to increased hair thinning and shedding. There's also a higher risk of developing alopecia areata, an autoimmune condition that causes patchy hair loss. Vitamin D is essential for tissue repair and inflammation control. People with low vitamin D levels may notice slow healing of wounds, cuts, and bruises. There's also an increased risk of infections in open wounds and prolonged inflammation, which can delay the body's ability to heal properly. Research suggests that vitamin D helps in the formation of new skin tissue and regulates immune responses involved in the healing process. Vitamin D deficiency is strongly associated with musculoskeletal pain. Individuals with low vitamin D levels may experience chronic joint pain and stiffness, especially in the knees, hips, and shoulders. There's also increased sensitivity to pain, as vitamin D is involved in nerve function. Additionally, there's a higher likelihood of developing fibromyalgia, a condition characterized by widespread pain and fatigue. Emerging research suggests that vitamin D deficiency may be linked to heart disease. Some possible cardiovascular effects include high blood pressure, as vitamin D helps regulate blood vessel function. There's also an increased risk of heart attacks and strokes and higher levels of inflammation, which can contribute to arterial damage. Several studies indicate that vitamin D plays a role in metabolism and fat storage. Deficiency in this vitamin may contribute to increased body fat accumulation. People might also find it difficult to lose weight despite diet and exercise. Furthermore, there's a higher risk of metabolic disorders including type 2 diabetes. Vitamin D is essential for regulating sleep patterns. Low levels of this vitamin have been linked to insomnia and difficulty falling or staying asleep. Poor sleep quality and frequent nighttime awakenings are also common. Additionally, there's an increased risk of sleep apnea, a condition that causes breathing interruptions during sleep. Some individuals with vitamin D deficiency report experiencing dizziness, vertigo, and balance problems. This may be due to the role of vitamin D in supporting proper nerve function and maintaining the health of the inner ear, which is responsible for balance. Vitamin D is essential for maintaining healthy teeth and gums. Deficiency can lead to an increased risk of cavities and tooth decay. Gum inflammation and bleeding, also known as gingivitis, can occur. If left untreated, this can progress to periodontal disease, which can cause tooth loss. Long-term vitamin D deficiency has been linked to a higher risk of developing several chronic diseases, including osteoporosis, due to decreased calcium absorption, type 2 diabetes, as vitamin D affects insulin production, certain cancers, including breast, colon, and prostate cancer. Certain groups are more prone to vitamin D deficiency, including people with limited sun exposure, like those who work indoors or live in areas with long winters, individuals with darker skin, as melanin reduces vitamin D synthesis, elderly individuals because aging decreases the skin's ability to produce vitamin D, people with malabsorption disorders such as Crohn's disease or celiac disease, those who follow strict vegan or dairy-free diets, since vitamin D is found in animal-based foods. To maintain healthy vitamin D levels, consider sun exposure, spending 10 to 30 minutes in the sun a few times a week, dietary sources, consuming foods rich in vitamin D such as fatty fish, egg yolks, fortified dairy products, and mushrooms, supplements, taking vitamin D3 supplements if advised by a healthcare professional, regular testing, checking vitamin D levels through blood tests, especially for at-risk individuals. Vitamin D deficiency is a widespread issue with significant health consequences. Recognizing the symptoms early can help prevent complications and improve overall well-being. By maintaining a balanced diet, getting enough sunlight, and considering supplementation when necessary, individuals can ensure optimal vitamin D levels and support their long-term health. If you suspect a deficiency, consult a healthcare professional for proper diagnosis and treatment.